Okay, here we've got angioedema. Angioedema is depicted by the edenomy flying, so it's angioedema. This is a type 1 hypersensitivity reaction where you have rapid, painless swelling of the lips and face, eyelids, tongue, floor of mouth, and larynx. IgE releases histamine, so you get it's basically like Will Smith on that show, that movie. I forget the name of it, but the Will Smith dating movie. So that's how you can remember it. It is a there's three forms of this. There's the non-hereditary form. With the non-hereditary form, it's the most common, depicted by the number one, and the comma, putting up the number one finger. And it is an allergy to antibiotics. Trauma and latex can also cause this. The second type is the hereditary form. The hereditary form is an absence of the C1 esterase, which I depicted with a nest that doesn't have an egg in it, and it's dreaming about having its egg. So the esterase is the missing egg that this nest wishes that it had. The third form is an ACE inhibitor. The ACE inhibitor is caused by increase in bradykinin, and like I said before, all of these are painless. Just a couple other facts. Usually lasts 24 to 36 hours. If it involves any part of the throat, it is a medical emergency. You need to go to the emergency room. You want to treat with antihistamine and an EpiPen if breathing difficulties, or IV corticosteroids if the EpiPen isn't effective. You're not going to do this. A doctor will do that. You don't want to deal with systemic corticosteroids. In the hereditary form, 25% end in a fatal airway blockage. This is definitely the worst kind. It won't respond to antihistamines or an EpiPen. The only treatment is to maintain the airway until it fixes itself. And then the ACE inhibitors reaction. So this is a reaction to ACE inhibitors where you have an increase in bradykinin. This can cause airway obstruction. The treatment is with antihistamines and steroids. You can try the EpiPen, and you also need to maintain the airway. So just to recap briefly, it's type 1 hypersensitivity. There's three types. There's non-hereditary form, which is an allergy. It's the most common, allergy to antibiotics, that sort of thing. Type 2 is a hereditary form where you're missing a C1 esterase. And then the third form is a reaction to ACE inhibitors where you have an increase in bradykinin. All these are painless, and you're just going to have this big angioma, this big puffy face.